across the country, we see that the number one liability risk facing OBGYNs is a delay in responding to emergency situations. OB hospitalist programs can help reduce that liability risk by having a board-certified OBGYN in-house 24 hours a day, 7 days a week, who can respond to that emergency situation and begin a plan of care for that patient even before the private physician or midwife arrives in the hospital, thereby improving both maternal and neonatal outcomes and reducing overall risk. When hospitals set up an OB hospitalist program, they have to be aware of a number of challenges that they might face. One of those challenges is that the OB hospitalist will be a new provider for many of the patients that they see. It's incumbent upon the OB hospitalist to be a good communicator and tell the patient the purpose of the visit, what to expect during that visit, and what are some of the expected outcomes of the care that they provide. In addition, the patient is going to want to hear from the OB hospitalist how this information will be communicated back to their primary provider once the visit is completed. Another challenge that is faced by OB hospitalist programs is the fact that multiple providers might be involved in the care of a single patient. This means that each provider must provide an adequate handoff to the next provider. The hospital and the hospitalist program need to make sure that systems are in place so that these handoffs occur in a standardized and efficient fashion. Another challenge that is faced by an OB hospitalist is that they are the default provider for the unassigned patient that presents to the hospital. These unassigned patients may come from a different facility where they had prenatal care, but that information is not available to the hospitalist at that time, or they may have had limited or no prenatal care, in which case no information is available to the OB hospitalist when the patient's in the hospital. It's incumbent upon the OB hospitalist then to fill in those gaps to the best of their ability to provide good outcomes for both mom and baby. When setting up an OB hospitalist program, the hospital has to be very careful about developing policies and support practices that will allow the OB hospitalist to be successful. Some areas of concern that can arise are who backs up the OB hospitalist in the event that multiple emergencies are occurring at the same time, who follows up for unassigned patients when they present to the hospital and then need outpatient care, which the OB hospitalist doesn't provide, and how do you manage a credentialing process for an OB hospitalist who may have limited number of procedures in a credentialing period, especially when it pertains to gynecological procedures.